Joining me from Los Angeles is Dr. Gary Richwald. He's an infectious disease expert and the chief medical officer at Real Health. A lot to talk about, Dr. Richwald. Let me begin with President Biden's new strategy, restrictive testing requirements for international travelers, including U.S. citizens, extending those mask mandates on public transport. Are they enough to mitigate the spread of this new variant, Omicron?
Well, I think the answer is it depends how infectious it is. I think we had information released this morning. This is an unreviewed paper at this point from South Africa, showing that the Omicron variant is if you have that, you're 3 times more likely to have ended up, just looking at the abstract now, you're 3 times more likely to become infected, that is, have reinfection, because you have to understand, in South Africa, most people have not been vaccinated. Obviously, a lot of people have had what we call regular COVID infections, and that quote-unquote natural immunity is 1/3 less powerful in terms of preventing them from getting infected than it is with the Delta variant. So this is bad news. I mean, this is saying this is a highly contagious virus. And so if these studies turn out to be the truth and the data continues to fall in this direction, then this may not be enough. I'm an optimist. Being a virologist, one has to be in a certain sense because there's always a lot that we don't know. It's my opinion that these, the president is having an incredibly heavy lift here. As you said, we have 77% of adults who have been vaccinated in the United States have not gotten their booster.
Let me get to that, Dr. Richwald. Let's talk about the first cases in this country. The first one was in California, San Francisco Bay Area. The second one in Minnesota. Both cases, they were vaccinated and had mild symptoms. The California case, that person did not have a chance to get a booster. He was not eligible yet. The person in Minnesota did have the booster. So what does that tell us? You know, there's a lot of people in this country who are not getting vaccinated. They're going to look at this and say, look what happened. You guys got vaccinated and you still got this new variant.
Well, the approach of vaccination is to prevent death, prevent hospitalization. And that's always been the goal. And I think we have to keep that in mind. And unless we can get enough people into the boosted category, and of course, vaccinated category as well, who are unvaccinated, we're going to have a tough time here. And personally, I would have liked to have seen financial incentives for people to get their boosters and to get vaccinated.
So are we going to see, Dr. Richwald, another round of severe lockdowns and mask mandates that go beyond public transportation in this country? Is this another case of deja vu, if you will?
Well, so sorry. I think that I don't know yet. I mean, it could be. But I think the president is, again, he's upbeat in regards to the fact that we have a lot of resources and he is throwing everything against the wall here to make sure that if the Omicron turns out to be a problem, that we're prepared.
And if existing vaccines, if it's proven that they are not effective in protecting us, where do we go from there on?
We're going to have a tough 4 months or 5 months that it takes to make a variant-specific vaccine, one that will address this variant or perhaps some other variant down the line, and actually bring that out into the marketplace so that people can be vaccinated. And it could be a difficult year. We could have a twindemic as well of influenza and COVID. And I say twindemic because when people get good and sick with influenza, as an adult physician, I know all too well that they need to be hospitalized. And it could be a real press for our hospital systems to handle both a COVID variant, if it turns out to be problematic, plus influenza.